half of the calories that the average American adult consumes are from ultra processed foods, also called UPFs. And UPFs have become a popular topic of conversation and a growing concern in public health. Joining me now to address this problem is Dr. Emma Spalding, an emergency medicine and weight loss physician. Welcome, Dr. Spalding.
Thanks for having me.
Yeah. So, what are some of these UPFs? Like, what are some examples that people may not even think of are ultra processed foods?
I don't know. I don't know. People wouldn't think of them as that. I just don't think they think about it in general. Um, if you go to any grocery store, I would say 70% of what's in there is probably processed to ultra processed foods. So all your cereals pretty much, excuse me, um, a lot of your baked goods, anything with a bunch of extra sugar in it, if you go to the bakery or whatever, you got to look at the deli meats. If you were to go to Publix, for example, or I don't know whatever local grocery store people have, there's Publix in Atlanta, for example, it's Publix in the South. But, your deli meats have a bunch of nitrates in them. Boar's Head is probably one of the few that doesn't, if you're actually checking. A lot of packaged foods, talk about things like ramen noodles, a bunch of canned goods. Some canned goods are okay, and some processed foods are still actually somewhat okay for you because they do have some nutritional value, pastas, some, boxed or canned or pre-cooked rices, things like that. So there will be some, but it's probably about 70% of the food out here is ultra processed food. It's unfortunate. So.
And, it's one of those things, if we go backwards, how do you define what is ultra processed food? Like for the person who's never heard this before.
Well, ultra processed food is going to be any food that, well, let's talk about what's not ultra processed first, right? So many of the meats you get, you got to be careful with ground beef, maybe ground turkey, ground meats. But most of the meats you get are going to be just a little bit processed. The dairy is going to be a little bit processed, like milk. Fruits, pretty much there's no process, just depending on where they're sitting at. Was it a clean environment? Were there bugs? Is there mold? Things of that nature. But mold's a good sign that something is very organic because things should go bad pretty quickly. So those are not processed foods, right? So ultra processed foods are anything that's been through. How can I say? Well, it's a process. It's been through a process that does things like it could strip the food, it could enrich the food. If you look at our breads, for example, our wheat, our enriched, all this enriched flour we consume. Bread is not supposed to last as long as it does. If you go get a loaf of bread from the store, it should not last you a month. It should be done in 3 to 5 days. So we strip away so many things, nutrients, from things like that to make them last longer. You get enriched rice, sugar gets processed, So anything that is an organic that goes through some process of stripping it down or adding to it, sometimes adding preservatives. For example, we add high fructose corn syrup to things. Why? Because it preserves well, it travels well. It's a very stable type of sugar syrup. So that's why we use it. That's why it's used in so many things. So anything like that is going to be considered ultra processed. And you just have to read the back of it. You have to read your packages. You have to read the back of your, anything that you buy, and to really see. You don't have to read but three, 4 words before you realize it's probably terrible for you. So
Right. And consuming large amounts of this ultra processed foods, what does it cause? What kind of illnesses do we see at the other end of that?
Well, so if you look at it overall, you've got an obesity issue in America, in the West. I think, roughly 60% of the population now is obese. And as far as morbid obesity, like truly scary, increased morbidity, mortality, more obesity is like 10%. And hypertension, hyperlipidemia, bad cholesterol. Overall, the main thing, you start to look at cardiovascular disease. You start to look at how much stress are your kidneys under. You have visceral fat being deposited in your belly, in your liver. Metabolic syndrome, which is a big problem, a growing problem. So this is the type of things that that these processed foods can cause, eating, especially the regular large quantities that people eat them in.
Mhm. And what do you do if, when people come to you and they say, "Hey, you're telling me that 70% of all the food that I can actually consume in this grocery store has these ultra processed factors in it. What do you do? What can I do
Well,
to
processed to ultra processed, yeah.
right? So what do you tell patients who say, "Hey, I'm tipping the scale. I know I should not be eating this, but I have nothing else to eat." What can they do to help themselves?
Well, obviously, admitting yourself there's a problem is a good step, is the first step. I mean, the next thing you got to do is probably get some help, because if you're not the type of person who's been on it already, it's going to be hard to start on your own, because it's not just about changing your diet. You have to change your whole lifestyle. You have to become a different person, not altogether, but just certain habits are going to have to go. You have to cut out certain things you consume in large quantities, in some quantities. Some things are going to have to go altogether. Um, so when you say, well, what do you tell them? you know, First thing you have to do is try to start them on the mental and emotional preparation for the journey, because it's once you start it, stopping it is not really an option. It shouldn't be anyway. So, they say, hey, what am I going to do about this diet? What am I going to do about this? What am I going to do about that? You just got to sit down and help them develop a plan. That's pretty much what we do in our weight loss clinic. Is we don't just give them, say, GLP-1s and meds and stuff. We develop a lifestyle plan, and we help them track their calories. We help them start activity levels. Okay, week 2 now, week 3 now, week 4, we ramp it up. We pay attention to their labs, make sure their physiology is remaining in homeostasis. I mean, so there's a lot to it, and you got to tell a patient really that this is a journey, but we're taking it together. I'm gonna be right here with you, you know, helping you along the way. At least, if any patient that goes to a doctor, that's what the doctor should be doing with their patients, in my opinion.
Yeah. And how do people get access to weight loss clinic, right? Is this something that is in available at every hospital, or is this specifically for yours?
Until I got into it, I didn't realize how they're everywhere. I just got I was just at work earlier, and I was looking at Google in between patients for something, and I saw a news feed, news story that said Forbes top 10 weight loss options, and it's like these 10 weight loss businesses or clinics that exist somewhere around the country, right? So they're everywhere. I mean, they're everywhere in Florida for certain. I mean, Florida being Florida. Um, so you can what you got to do is you have to, like you do any business, you got to look up, check the reviews, check the results, because most weight loss clinics actually online track the results of their patients, so you can see what is the average weekly weight loss, what's the average biweekly, what's the average monthly weight loss. You know, what are the side effects of these medications? Who's having more success? Who's highly rated? Do you like the staff? I mean, there's all types of factors that people go to clinics or doctors, as you well know. So, I mean, you can easily just Google weight loss clinic in whatever city you're in, and then you start looking at the reviews and compare and contrast. And then what you do is you go visit a couple, and you go and see, hey, is this pricing right for me versus this? What is this program? But you don't just want a weight loss drug. It's not. That's not enough. That's not enough. The biggest thing for weight loss largely is diet, which is why when you talk about these processed foods and you combine it with the fact that they're always so readily accessible, because we have a lot of food deserts around the country. I mean, it's difficult. It's really difficult.
Right. You hit on the nail on the head with the food deserts. What do we tell Americans? What do we tell our patients that say, "Hey, I'm in the middle of a food desert. 70% of the restaurants that's around me are really these fast food chains, and that's basically the only thing I can afford to do." What do we say to them, and what do we say for their children's sake? There's a statistic that 70% of all the food consumed by children are ultra processed foods, and we're seeing diabetes and hypertension younger and younger ages now. What can we say to give them a glimmer of hope?
Well, to answer the first part of your question, you got to cook. You got to cook food at home. I mean, honestly, if you look at it, let's say you buy a package of chicken, like thin cutlets of chicken or something like that. And then let's say you buy, some green beans or broccoli, and then you buy some starch. You can buy some bag of rice or some potatoes. That's going to cost you Probably, let's see, the average price of chicken back then about $12, and then the premium about another 20. So, and then the potatoes is about a 70-pound bag of potatoes. So you're looking at about 30 something dollars, right? The
Mhm.
average fat, and that's if you take that meal, if you took that food, you could eat on that all day, right? For the whole day, you could eat on that. If you go eat at a fast food spot, okay, if you do that 3 times a day, not only are you going to be paying the exact same amount, if not a little more, you're going to be eating the most unhealthy stuff on the planet, and you're going to be washing it down with some sort of soda or something terrible that's
Right.
got 50 grams of sugar per serving, which is
Right.
crazy. So you're going to have to start cooking. So the second part of your question is parents need to be parents.
Mhm.
That's it. Like that's full stop. That's kids don't control what they eat to a large degree. Your parents do. Well, whatever you put in the house, they'll eat or they won't eat. But you don't have to have all the badness. You don't have to have all that. It's okay to have that stuff every now and again as a treat. That's fine. Your body can deal with it from time to time. But that shouldn't be you shouldn't be snacking on Pringles every day and candy every day and whatever chips and cookies, whatever cakes. It's a bad idea. Bad idea.
They say if it's not in the pantry, it's not in your mouth, and it's one of the things we have to start to face and say, hey, do I need to buy this right now, and make just different choices. It's difficult.
Mhm.
I know it is very difficult, but it can mean the difference in a long life and a long, healthy, quality life. So
That's true.
we thank you, Dr. Spalding, for your words of wisdom, and we look forward to having you back.
You're welcome. Thank you.